It's become a regular scene near the port of Calais in northern France. Every other day, the police come to evict asylum seekers from their makeshift camps. With the COVID-19 crisis, the closure of borders has frozen their attempts to go to the UK. And as for all those living on the streets, survival is now more difficult than ever.
This corona is too bad. Before, there are some car came and you get your chance, but the situation is difficult now because we don't have anything here.
Throughout France, charities were forced to scale down aid during weeks of lockdown. Supporting the needs of an estimated 1,000 people in Calais has become a real challenge.
There's less of a presence in the camps, less services, so the conditions are getting worse. And from another side, those who are helping are prevented from doing so. We've had 26 fines for going out on patrol, delivering food or blankets. And 4 members of the team were taken into custody while carrying out humanitarian work.
This NGO is one of the few authorized to deliver food to asylum seekers in the area of Grande-Sainte, a few kilometers away from Calais. Basic medical checks are carried out each day.
Every vulnerable person or migrant gets their temperature taken by the civil protection teams. In case there's a problem, they report it and take them to hospital if needed. Until now, no COVID-19 cases have been spotted on this site, at least in the past 2 months.
The dire conditions in which people live affect them more, they say, than the virus.
People don't scare of coronavirus because, they had lots of problems. They passed lots of dangerous things that those were more than coronavirus dangerous. They are here, they don't scare of coronavirus.
Yet the pandemic seems like a double punishment for the most deprived. Let's meet those who've been pushed even further into limbo by both exclusion and the lockdown. We're on the outskirts of Lyon in the southeast of France. Most of the families living in this slum are from Syria. Still pending refugee status, they cannot find housing or employment and no longer receive asylum seekers' allowance. Help from a charity started by these women during lockdown and from local residents is crucial.
Since the coronavirus started, nobody comes here anymore. We met Sophia and Nawal, who came to help us. Our Arab brothers also came to help us. We asked God and the French government to help us, to restore our benefits. As soon as they do this, we'll leave immediately.
No one here has been infected with COVID-19, but sanitary conditions are extreme.
We found nothing else. We even tried to squat in a house. We stayed there 4 days and the police evicted us. My husband tried to search everywhere without any luck, so we built this place so that I could give birth, and now we live here.
I have 2 children. I want to send them to school. It's no life. We have no toilets, no water. France treats us well, but we need help to sort out our situation and get the documents we need. We can't live like this.
The pandemic has only made the wait for answers to administrative procedures, undertaken with the help of Sophia and her team, even longer. And with lockdown ending, the threat of eviction is looming.
I fear the worst for them because we've had no official answer at all. In any case, when we do have answers, they're pretty negative. So if they're expelled from here, where will they go? What will happen to them? We just don't know.
For the most deprived, access to care is also a challenge, even more so in a pandemic. Across the country, mobile health teams have been deployed among the most vulnerable to prevent and detect COVID-19. We follow one of them to a disused garage that's been transformed into a squat. Around 80 people, all Roma families, are living here.
It's a critical problem, the virus. We have no drugs, we have no money to go to the pharmacy to buy gloves or masks.
The community shares 2 toilets and a water hose.
It's too difficult for us. We don't have anything to wash clothes. We go over there to wash, and for the kids it's cold. If they get sick, what are we going to do?
No case of coronavirus has been identified, but the risk is never far away.
We're seeing patients with cardiovascular diseases, respiratory diseases. These are vulnerable health conditions that are potentially very serious in terms of COVID-19. The challenge is to identify these and get them taken care of properly. That'll make it possible to stop the disease from spreading and perhaps save some beds in intensive care units. But the real question is, how do we properly take care of the most fragile, the homeless, and give them decent living conditions to avoid problems we're seeing? If we'd taken care of this before, we'd probably have far fewer serious cases and better follow-up.
Decent living conditions for the poor, it's a plight which torments Kamel, who regularly helps this family. They've lived in these cars in the heart of Lyon for years.
It's my dad. He's 70 years old. He's in the car here. It's hard for him because he's old and he's sick. And look, this is my car. 6 people sleep here, 4 children and 2 adults.
Unable to find work, they survive by begging. During the lockdown, that was next to impossible, and it's still a challenge. But there's no alternative, they say.
There's no other solution. A man said to me, "Lady, go away. There is the coronavirus, but I will risk death to find food for the children. It's so difficult, the coronavirus."
It's true that by staying confined here, they are less likely to catch corona. But beyond that, they've been living here for years. If I don't bring them food or ask others to help, nobody moves, neither the government nor the town hall, nor anyone at all. So what now? Will they have to stay here all their lives?
Our day ends under this bridge, in one of the city's upscale neighborhoods. Several families have been living in these tents for months. They say they can take no more.
We've been on the streets looking for work, then the virus came and that was the end of that.
We can't go out to find work, we can't live, people are scared of us, they're avoiding us, and we're avoiding them because of this virus.
I just want to go back to Romania.
We need to find work. Now we're just waiting for the borders to open to go home. We can't stay here any longer.
Poverty and the COVID-19 crisis are likely to crush that hope for long.